After spending a day at the park, you notice a serious rash on your arm and promptly visit your doctor. She has a look, but tells you she'll need to send a tissue sample to a pathologist. But what does that mean? Pathology is a study of disease, spanning everything from infectious influenza to cancer. But how do doctors know whether tumors are benign or non-cancerous or malignant and prone to causing cancer? It all starts in your cells. A group of these cells that share their structure and function are known as tissue. Doctors will collect tissue samples from patients and look at them under a microscope. Sometimes, however, microscopes are unable to show abnormalities, like if they are too small. This is where digital imaging comes into play. But what is digital imaging? We spoke to Dr. Ipshita Kak, a professor of pathology and molecular medicine at McMaster University, to give us some insight.
To understand how digital imaging works in pathology, we must first understand how a slide is made in pathology. When your doctor identifies a worrisome lesion, they take a biopsy or aspiration or resection of this lesion. When this comes to the pathology lab, it is given a unique lab identifier number by a process known as accessioning. Next, the tissue is examined and described in a process referred to as gross examination. The tissue is then subjected to chemicals to preserve the tissue for microscopic examination through fixation and processing. This processed tissue is embedded in paraffin wax and then can be cut into ultra-thin sections onto a glass slide that is then stained for pathological examination. Digital imaging adds another step to this process by using high-throughput scanners to scan the pathology glass slide and convert it into an image that can be viewed on monitors instead of under the microscope, as is traditionally done for the glass slide.
That sounds simple enough, but are there any drawbacks to using digital imaging?
The biggest first hurdle in adoption of digital imaging in the mainstream is upfront expensive equipment and storage. Another recent barrier was the validation of the technology at each given hospital and consolidation with the pathology lab's workflow and information systems. However, there are now numerous guidelines from Canadian, American, and European organizations to effectively manage this component. Certain sample types are particularly challenging to assess on digital images, namely cytology and bone marrow preparations, as these can have 3D clusters that require a combination of high power and fine focusing on the microscopic slides, which can be difficult to replicate in digital images. Finally, successful setup of any digital imaging software also requires robust quality checks to ensure that all of the tissue on the slide is being captured in good quality.
We now know what digital imaging is and any potential drawbacks, but how is it being used in current pathological studies?
Currently, digital pathology is used extensively in education. Teaching for both trainees as well as continuing education for pathology staff at conferences has been revolutionized by the addition of easily accessible digital images of slides. The testing or examination for pathology trainees has also moved to the digital format. In the research realm, digital imaging with applicable artificial intelligence programs is being used on vast amounts of pathology image databases. This is allowing with increasing efficiency and accuracy for certain routine pathological tasks or diagnosis to be aided by this new technology. In the area of clinical use, digital imaging is being increasingly used for both primary as well as secondary or consultation diagnosis.
Well, it seems like digital imaging is pretty versatile, but what do doctors like yourself use it for?
I am currently involved in a project exploring digital imaging in cytology, which has been an area of particular challenge for this technology. While digital imaging is being adopted more and more across pathology labs in North America, most pathologists maintain a healthy skepticism of this novel technology, as is routine with any new change process in medicine. However, the data and standardization have become extremely robust, along with publication of validation guidelines, which is propelling the field from niche to mainstream.
A few days later, your doctor calls you back. Your results are in. The slide your doctor uploaded was examined by pathologists across the globe, a form of social media in a sense. She tells you you simply scratched your arm. You leave the clinic with a smile on your face. Instead of waiting weeks or months on end, you're able to sleep easy, all thanks to digital imaging.